Dr. Muhammad Abrar. I'll be taking your pathology lectures. So it's not only me, there are two more pathologists who will be taking the POD block. One is Dr. Oban, Dr. Abdurrahman Oban, and the other is Dr. Rehan Sajid. So we are three people covering your whole POD pathology, different sections, right? So pathology is new for you. Until now, you're studying anatomy, physiology, biochemistry, histology. These are all normal. But now we'll be starting pathology. Anybody knows what is pathology? Any idea what is pathology? Study of disease. So it's simple. What is pathology? It's a study of disease. So in a scientific way, yeah, it's a study of disease. And in a broader sense, it's a study of how the organ or tissue of the healthy body changes into the sick person. So anatomy and physiology, we were looking everything normal. But if something is abnormal, then we have to go through the pathology process. Remember, even if you pass your third year, second year and third year, you are in a clinical site, in your clerkship. If you see your pathology before going to the patient, it will remind you everything because pathology is the main important basis. So if you are good in pathology, you will look after the patient correctly. Okay, so the structure and functional changes that leads to loss of normal health. So we will be studying how the normal healthy person is turning into the abnormal one, and that is pathology. In a way, we can say it's a bridge between the normal things, which is anatomy, physiology, biochemistry, cell biology, and histology, to a clinical practice. So whatever changes happens in a normal one, the patient will show some clinical signs. So this pathology is a bridge between these two. There are multiple branches of pathology, multiple branches. We means the histopathologist. We are actually looking for the anatomic pathology, which deals with histopathology and cytopathology. What is histopathology? Histopathology, for example, if a patient had an appendix, you know what is appendix. And if it is inflamed, we call it appendicitis. And the surgeon go for operation. And he takes out that appendix of a live human being. And they take the appendix and send it to the pathology. That's called biopsy. Biopsy is taken from the living person. Biopsy. Then he sent that appendix to the pathology lab, and we, as a histopathologist, we go through a multiple process and we give the report. We give a gross feature of that appendix, how that looks like. Then we cut it in different sections. We see under microscope, and finally, we give the report. This is called histopathology. The other one is cytopathology. What is cytopathology? We don't take out the whole structure. For example, if a patient has a swelling here or thyroid, you have gone through thyroid, endorepro block. So you have a thyroid, any patient who had a thyroid gland enlarged, instead of taking out the whole thyroid, you just put a needle in it, take some of the cells, spread on a slide, stain it, and you see under microscope. That is called cytopathology. So you just looking into those cells, you are able to diagnose what disease is it. The difference between these two is, although cytopathology is little different because you are only looking at the cells. You are not looking at the whole structure. But if you are a very good cytopathologist, more than 90% of the disease can be diagnosed, right? And then finally, if you want to confirm it, you can take a biopsy of it. But normally, if you are doing cytopathology, you don't need a biopsy. The advantage of cytopathology is you can do it in your office. You can pass a needle here and take the cells, spread it on a slide, and give the, and then you can give your report. For biopsy, you you have to book for the operation theater, you have to book for the anesthetist and everything, you know. So, anything now? No. So, biopsy is little invasive procedure. Cytopathology is not that much invasive. You can do it in your office also. The other branch of pathology is hematology. It will appear then. What is hematology? It's a pathology which deals with the blood diseases. Any of the blood diseases like anemia, leukemias, right?
I'll be outside. I'll come back at the end of the session.
Okay, so it's going on
Yeah.
normally. Okay. So anemias, leukemias, thrombosis, embolytic phenomena, they all actually we take care in the hematology one. Then we have microbiology. Dr. Atif was here, right? He is a microbiologist. And the study of microorganisms, normally, we deal with this pathology, microbiology. It covers bacteriology, fungi, viruses, right? Rickettsia. But along with this all, protozoa, important. Along with this, we also cover some helminthology or helminths, like roundworm, tapeworm, hookworm. They are also covered in this microbiology studies. Immunology, definitely it's a branch of pathology which deals with immunological processes of the body. Immunology, how your immune system is working, right? So this will be taught by Dr. Gawa. Hematology, you have 4 lectures of hematology, and that will be taken by Dr. Rehan. Anatomic pathology, definitely me and Dr. Gowan will be taking care of. Dr. Oban will be taking care of. Chemical pathology, as the name says, in pathology, it's really a big branch. And in your daily life, if somebody is diabetes, the first thing will you do is ask for blood sugar. Either it is fasting or random. This blood sugar, blood urea, LFT is liver function test, or cardiac enzymes. These are all chemical tests which are done under the heading of chemical pathology. Then we have genetics. It relates with the genes of the body. There is a full genetical studies in pathology. So we have different lectures of genetics also. Then toxicology and forensic pathology. There are 2 branches which are actually held together. Forensic pathology, when we do the same thing in a dead person. So if we take a piece from the dead person, that's called autopsy, not biopsy. Biopsy is taken when the patient is alive. Autopsy is done when the patient is dead. And the toxicology, which actually tells us that which poison or which chemical has killed this patient, right? So this is a study of a dead person. So these are the different branches of pathology. Any question? Okay. Unfortunately, I cannot ask from online, but by the end of the lecture, probably Dr. Fariha will come and we'll take that questions. So there are 2 major branches of pathology, basically. Now I'm talking about the anatomic pathology which we are dealing with. One is general pathology, and the other one is a systemic pathology. In general pathology, which you will be covering now in POD block, we will just discuss the general ideas of pathology. We are not going to the specific part. What do you mean by specific part? We are not discussing what is going on in respiratory system, what is going on in GI system, what is going on reproductive system, what is going on in CNS. We are not touching the specific systems. We are talking in general. In general. For example, inflammation. What are the different types of inflammation? What are the chemical mediators? So we are talking in general. Then in third year, we will pick one by one every uh, every system rather. If you are touching or taking the respiratory system, then we will discuss the inflammatory processes, the neoplastic lesions, whatever. So that will be the specific systemic one. Here in POD block, we will be touching only a general pathology. So other branch is a systemic one. As I said, we will deal individual system separately, but it will be done in third year. Okay. Then what is usual and what is normal? For example, it is usual to have atheroma in a coronary artery, especially in the middle-aged Saudi man. Is it normal? Now, if you see here, this one, this is basically an atheroma. Atheroma is excessive deposits of fat in a coronary artery. What does it do? It blocks the coronary artery. Normally, the coronary artery size was this much, right? But slowly, gradually, it is compressing the size or the lumen so narrow that it is hardly allowing the blood to pass. And one day, what will happen? It will it will completely occlude the coronary artery. And when it is occluded, what will happen? Myocardial infarction, right? So it is usual, but it's not normal. And why we see here in Saudi population, they are common here. Why? Because here we used to have a lot of fat, butter, laban, huh? and labna, I don't know what fatty things. And we have a lot of junk food also. Our young people, young students, they used to go and have burgers and pizzas and many other things. No problem. If you have once in a week, if you go and have a pizzas and have your KFCs, and it's okay. But if you are taking it daily, that will cause a problem. That will actually accumulate the fat in your coronary artery. Having such amount of fat, you had to have excessive exercise. I have seen students, if you have to take something from just 100 or 200 meters outside your house in Bakala, from Bakala, they used to take their car, sit there, and went there and take the thing. This is wrong. You had to walk. The amount of fat you take, then you had to take to do such exercises. And if the exercise and the amount of food is equal, then you will not get this thing. Otherwise, it will cause slowly and gradually you will become obese and the fat is going to accumulate in your body, which is bad for your health. Now, how it cause leads to effect. Now, this person who is having excessive amount of fat, the coronary artery, this one, which is normal, and the lumen is so big, slowly and gradually, the atheroma is starting here, and the lumen is slowly and gradually compressing. And a time will come that it totally occlude the artery, and which occlude the artery, it will not allow the blood to flow in the lower part of that. So this area will be infarcted, as you said. When there is infarction, what will happen? The patient will feel pain in the chest, excruciating pain. It's very painful, right? You take the patient to the hospital, and the first thing you do is ECG. You see an abnormal ECG in this. And then you go for angiography and you see there is a blockage here in the coronary artery. So first thing will you do is to do it medically. You give a drug, streptokinase. It's a very magic drug, which can, if there is block, it can easily take out the block when a thrombus is there. So you can even allow the patient to recover soon. And after that, then you see how many arteries are blocked, and you can do some operations for that. You know about it, right? Then suppose, unfortunately, that patient dies. Then you take autopsy, as I said. So you have, this is a part of a heart which you have taken out, and you have seen that this much area, this is a normal looking heart, and this area has been infarcted. You have sent this piece to pathology department, and this is our job to see that, this is an infarcted area. We take a section from it, and we'll do the whole process. It's not you take a section and put it in a slide. No, you have to take the section and do dehydration. It's a big process. It takes usually 24 hours to dehydrate the thing, and then we cut this section in 3 to 4 microns. Just imagine how small sections you need. And then you go for staining. The common stain which you use is HNA, hematoxylin eosin. Hematoxylin usually stain the nucleus. Eosin used to stain the cytoplasm, pink color. And then you see such type of histopathology, right? So what is this histopathology? This one. Oh. So what is this histopathology? This is actually showing that the muscles, the pink color muscles, are infarcted, dead. You don't see any nuclei in these muscles, only pinkish. And which type of necrosis is this? Anybody? Although it will be learned, because after this lecture, Dr. Oban will be taking cellular injuries and infarction necrosis and apoptosis. This is, yes? Yes, which necrosis? No, structural one. When you preserve the structure, what that necrosis called? No, it's called coagulative necrosis. So what you see is the whole thing become coagulated, right? So you just see the outline of the muscle. You don't see the nucleus because it is dead. And these are, what are these? This blackish small thing, these are all inflammatory cells, right? And how they are coming here, why they are here, we will be discussing in the inflammatory topic. And the whole inflammatory process, I'm going to teach that after your cellular injury topic, right? Okay. Now, a disease as a failure to adopt. It's a very simple thing. You just have to understand. For example, sudden loss of blood will cause shock. But if somebody has a slow loss of blood, what will happen? Nothing will happen. Slowly and gradually, if blood is coming out, nothing probably will happen. But if you had, God forbid, if somebody had accident and a heavy loss of bleeding is going on, then there is a chances that he will go in shock and the patient may die. Influenza virus. I'm not talking about the corona one. Influenza. You used to have a cough, upper respiratory infection, usually a small amount, and usually you take medicine or you don't take medicine, and you become all right within 8 days. They say that if you take medicine, it will take 8 days to recover. If you don't take medicine, it will take 1 week to recover, right? So you don't have to do that. But if you have excessive amount of virulent viruses in, that will cause pneumonias. Exactly HIV, a mild amount of viruses in the body may not do anything wrong, but in a heavy load of viruses inside, may cause immune deficiency or AIDS. Loss of ionizing radiation, you might have gone for X-ray department, X-ray chest, X-ray abdomen, whatever. It is usually been seen for your normal tests also. Having one or two X-rays doesn't do anything. But if you had a heavy ionizing radiation, that might cause cancer. Malaria, yes, malaria, if you don't treat it in a proper time, it may cause anemia, severe anemia. Unhealthy diet, as we were discussing, cause obesity, and ultimately it will cause coronary heart disease. Smoking, having one or two cigarettes probably doesn't do anything. But if the person is having one or two packet a day, this is a huge amount. It's a huge amount. That may cause even cancer, heart attack, or stroke. So on. So what influences ability to adopt? So there are some influences which can help in adopting. For example, age. When you were child, young, you are playing here and there, you are eating whatever you want, and nothing is going on, because whatever you're doing, it is easily be.
Doctor, are you comfortable with being on video? Some of the students who are not here have requested video.
No, it doesn't matter if you want. Yes.
Okay.
So is it possible to have both of it?
Yeah. So they'll be able to see you on video from home.
Okay. So I have to adjust this, right?
So wherever you usually stand, I think
It's okay. If you just turn it here, like this. Okay. So I think everybody online is able to see me. So we will be continuing from where I left, and you all know that I'm Dr. Abrar. Okay. So
Doctor, if you want a chair to sit on, I can get one.
no, it's okay. I'm fine. I'm even better standing, and even I'm better strolling like this.
Walking, of course.
This is the first time I'm keeping standing here in
near
the.
podium, of course.
You were there.
Yeah.
Have you seen me standing at one place? Okay. Age, I said. Children, they use everything, but they don't feel anything because they have the adaptability in such a way that they are, because whatever they do, they jump here and there and they absorb everything. But here in this age, even if of my age, I remember when I was a child, I used to take even 3 to 4 or 5 Pepsi bottles at one time. But here, one tin of Pepsi is difficult for me to complete. So this is adaptability, right? There are some genetic factors also. For example, some people are genetically predisposed not to be able to adapt to environmental insult. Some people have genetic factor like sickle cell gene or glucose 6-phosphate dehydrogenase gene. These genes protect that person from malaria. So malaria cannot happen in these patients who had sickle cell or glucose 6-phosphate dehydrogenase gene. Or if there is a mutation of cystic fibrosis, these patient does not have salmonella infection like typhoid. So this is a blessing to those, but on the contrary, it's bad. But there are some genes which actually protect the patient to have such diseases. Now, this is a chart which shows the genes as well as the environment one. So if you see here at this end, motor vehicle accident or gunshot, it's purely a environmental factor, pure environmental factor. At the other end here, this disease, which is cystic fibrosis or hemophilia, is 100% genetic one. Like this one, P53 in a cancer are BRCA1 breast cancer. BRCA1 is one of the gene which mutation take place and cause breast cancer, right? P53 is another which cause many other cancers. ApoE increase Alzheimer's disease. This is also genetic one. But if you talk here, motor vehicle accident, it's purely environmental. There is no genes involved in it, no genetic factor. It's all environmental one. Gunshot wound. But here, if you see the smoking, this smoking induced lung cancer, it is partially environmental, partially genetic also, because the person who is taking excess amount of smoking, 1 or 2 packet, it is causing changes in your body, right? And probably some mutation in the genes, and it finally gets cancer, right? So both of the effects are going on here. Here also, cardiovascular disease, diabetes, asthma, cardiovascular. If a person has a history of heart attack in his family at the age of 45, at the age of 48, at the age of 50, and if the family member has a heart attack, history of heart attack, his uncle, his father, his grandfather had a heart attack of this age, and still he is not taking care, he is eating more, he is obese, or even he is smoking, means environmental factor is also involved with the genetic one. Diabetes, they say that if one of the parent, mother or father, is diabetic, there is 50% chance that you may develop diabetes in later age. If both parents are diabetic, there is 70% to 80% chance that you will develop diabetes in the later age. What will you do? You have to be careful from the very beginning. This is your age. This is your age. You can defend yourself now. You take less amount of sweet things. You exercise more. Try to be not to become obese, so that obesity is also is a first step towards diabetes. So you have to do more and more exercise. So if your any of your parents, mother or father, is diabetic, you have to be careful from now, right? Asthma, yes, it's also environmental as well as genetic. Genetic, this patient has hypersensitivity. He had to take care. He does not go. For example, somebody has allergy to the dust. Don't go near dust. Sometimes we advise patient, for example, if there is areas where there are a lot of pollution, we ask the patient, please shift yourself to other areas where there is less pollution. And by this, he can cure himself. So both of the factors are going together. Okay. You can stop me anytime if you are not understood, please. I'm lucky to have such a big group here, alhamdulillah. I was expecting only few students, but there are a lot of students, mashallah, here. You can stop me anywhere. And probably it will help the online students also if they have any questions. So there are some examples between the genetics and environment. For example, some people exposed to HIV do not get AIDS. Why? Because this AIDS or HIV virus need CCR5 gene. They need this protein to enter into the body. So there are some lucky guy, they don't have CCR5. If they get even AIDS virus, it cannot enter into the body because they don't have CCR5 gene, right? Blessing in disguise. Some people who smoke never get lung cancer. Although he is smoking 2 packets a day since last 25 years. Being a doctor, you must face this problem whenever you say that please don't smoke to any of your family or any of your friend. They will say, oh, I have been smoking last 20 years, nothing is going on here. Why? Because these patient has a gene that encode enzyme which do the metabolism of these xenobiotics. What is xenobiotic? Anybody? What is xenobiotic? These are the harmful chemicals which develop by smoking. So if this harmful chemical which has developed inside your body and it has been metabolized easily, then definitely their adverse effect will not take place. So there are some lucky person who has this gene which metabolizes all of the xenobiotics and which convert that harmful chemicals into normal one. So they are not converted into cancer or any harmful thing. This is a lucky point for them. Some people exposed to penicillin have a serious adverse reaction. Serious. Why? Because they are hypersensitive. There are type 1 hypersensitivity in these patients. And if you just give one injection of penicillin, the patient will die on table if you don't check it. It's very, very serious condition. You had to, I'm sure you must have seen before giving any antibiotic, you do some hypersensitive test. You inject a small amount in under the skin and you wait for 10 to 15 minutes. And if nothing happens, you give the whole injection, doesn't matter. But if that area become red, right, hyperemic, means that patient is hypersensitive to that particular injection. Don't do it. Okay. Nomenclature. Now this is just to tell you that it's a big world, and if you are in one part, for example, if you are in Saudi Arabia, whatever diseases which we are looking at here in Saudi Arabia, it should be commonly called in every part of the world. For example, infection with Salmonella typhi, what we call it? What we call it if it is infection by Salmonella typhi? Typhoid. We call it typhoid fever or enteric fever. Not here in Saudi Arabia, throughout the world. Why? Because they made in 1918, they sit together, the American and Royal College, they sit together and they make a book in which the common diseases they list it together and finally make a chart that if somebody has diseases of caused by salmonella, it will always be called enteric fever. So whatever disease is going on, they have a common name to those diseases. So they make a nomenclature of the disease. So if you have infected here and now you want yourself to be treated in England or in America or in Japan, and you have a file showing that this patient had enteric fever, wherever you go, every person will know that you have a typhoid fever caused by salmonella. Malaria, it caused malaria fever, right? So on. So different diseases, they make a chart of it and make a final thing that it should be called like that. So still they have a book in England as well as in America, and they have kept it and they have circulated that book throughout the world, and everybody knows that this disease is called this one. So they don't have any problem. Amoebic disease caused by amoeba will call amoebiasis. Common everybody, right? Now there are few terms which I want you to please look at it. It will come probably in every section. So you should know morbidity and mortality. What is morbidity? Morbidity means a sum of effect of the disease on a patient. I mean, patient is alive and he has some effect. For example, if a patient has malaria, what effect will be that patient having? He will be having high grade temperature, he will be lethargic, sweating. So this is morbidity. Mortality means the disease which used to kill that patient. Mortality. How the patient is being killed is mortality. A probability of the death. This is mortality. For example, lung cancer. How much chance you have? That is called prognosis. How much chance this patient will die? If somebody has small cell carcinoma of the lung, it's a very dangerous disease. The prognosis is very poor. You hardly have 2 to 3 years for the patient to live. Although we have a very good treatment now, and the treatment, because of the change of the treatment modality, probability that the mortality has increased from 2 years to 4 years, but still small cancer has a bad prognosis. This is mortality. Okay. Now there are some terms like acute and chronic. I'm sure you must be aware of this one. Acute means rapid onset, right? The disease which rapidly come in, acute. And as acute it comes in, normally it goes off rapidly. Acute. In chronic, it is longer term. Disease which stays long. It starts long and it stays long and it takes longer time to be treated. Like tuberculosis. Like tuberculosis. It appears little late, and when you start treatment, it takes 5 to 6 months to recover. Then we have some prefix. Hyper. What is hyper? Yes? High. More. Hyper. Like any example? Hyper? Hyperemia, yes. And you have gone through this endorepro block. Hyperthyroidism. Hyperparathyroidism. Hyper. Anything which is more. Hyper. Right? Hypo. Low. Again, hypothyroidism. Hypoparathyroidism means low amount of hormone is secreting from that. Dis. Yes, very nice. It's disorder. Means dyslipidemia, lipid, abnormal amount of lipid in the blood, dyslipidemia. This is the disorder. This. Neo means new. New. What is the other word should attach? Neoplastic or neoplasia, right? New means new, new growth, new. Meta means, sorry, change from one cell to another one. Any example? Metaplasia of from yes, esophagus. Which type of metaplasia is that? From lower end of the esophagus. What happens? Yes. Never simple squamous, stratified squamous, please. Simple columnar, right? Because of acid. When acid goes up, it changes the squamous epithelium, which is a stratified squamous, into columnar epithelium. Usually I ask this question to the students, that tell me what is the lining epithelium of esophagus. Can anybody tell me what's the lining epithelium of the esophagus? Stratified squamous from top to bottom, or there is any change? Huh? Change. Which change? No. I'm just talking about the epithelium. Which type of lining epithelium you see in esophagus? Usually I hear such answer. Remember, esophagus is totally made up of stratified squamous epithelium. It's not change. In the lower part, when it is change, it's a disease which is called Barrett's esophagus. And Barrett's esophagus is caused by the acid which is actually coming up and injuring the squamous epithelium into the columnar one. And that metaplasia is called intestinal metaplasia. Because in intestine, from stomach till rectum, what is the lining epithelium? Columnar epithelium. So by having such a interaction with the acid, this squamous epithelium will change into the columnar epithelium. Okay. Metaplasia. Anaplasia means absence. Normally, if you have squamous epithelium, and if you don't, if it is changed like this one, this is squamous epithelium, right? It's made up like this. What happens in Barrett's esophagus or in tumor? We are talking about anaplasia now. In tumor, what happened? The whole squamous epithelium will look like This one. Can you able to understand this is squamous epithelium? Means it is poorly differentiated squamous epithelium, and the shape of the squamous epithelium is totally changed. This is called anaplasia. Understand? So if the shape of the cell is changed totally, this is called anaplasia. I'm sorry for the online students, which they're not able to see me what I was making in the chart. Then we have suffix. Suffix means at the end of the letter. If you have itis, means inflammation, itis, appendicitis, cholecystitis, prostatitis. Huh? So itis, if the word comes, means we are talking about inflammatory process. Oma, tumor, not cancer. There is a difference between cancer and a tumor. The tumor could be benign or malignant. If it is benign, it's not cancer. If it is malignant, yes, it is cancer. So tumor has a broad meaning, means you include both benign and malignant together, right? Okay, Oma. Like seminoma, lymphoma, fibroma, lipoma. So if OMA comes, there is some exception which I will tell you while we'll be discussing the inflammatory process, like granuloma. OMA comes there, but that's not a tumor. That's exception, right? Then we have oocyst. Oocyst is anybody? Oocyst means state or condition, like amyloidosis. When amyloid accumulates in a body, which is called amyloidosis, right? Oid. Oid means look like, look alike, are bearing the resemblance, like epithelioid, looking like an epithelial cells. The example is macrophage or monocyte. When it comes into the tissue, when it is circulating in the blood, it's called monocyte. When it goes out from the blood, enter into the tissue, it's called macrophage. And sometimes there is a condition when this macrophage change into epithelioid cells. Although it is the same macrophage, but the shape of the macrophage is changed. We call it epithelioid, oid, right? Penia. Yes, anybody? Decrease, decrease, penia. Lymphopenia or leukopenia means when the uh, concentration of blood white cells decreases, called leukopenia, right? Leukopenia, lack of, decrease. Cytosis, on the other hand, increase. If it is increase in the blood cells, like leukocytosis, you know the normal value, number of blood white cells, it is from 4,000 to 11,000. And if somebody has 15,000 WBC, that will be called leukocytosis. If it is less than 4,000, 2,500, we will call leukopenia. Good. Ectasia. Ectasia means dilatation. Duct ectasia. Ectasia. Okay. Then we have plasia. We have discussed this thing. Plasia means growth, means disordered growth. So if it is neoplasia, we combine together abnormal disordered growth, neoplasia. And usually we talk it when we are talking about the tumor, right? It could be either benign or malignant. Okay. Opathy. Opathy means, yes, again, it's abnormal state or lacking that exact condition, like in nephropathy. So nephron has some pathology and it is not looking exactly like that nephron. So nephropathy, opathy when we add that. So there are different ones. Now we have to classify disease. When a patient comes to you, you see the patient and then you had to classify to make your mind straight. Either it's congenital or it's acquired. So there are two important lines. Congenital, either it's genetic or it's non-genetic. What do you mean by genetic? It has been inherited from the family. So you must be having a family member of that condition. Non-genetic means spontaneous. Suddenly, the family doesn't have that thing, but suddenly you have that. Acquired, there are a big list. Is it vascular, infective, traumatic, autoimmune, metabolic, inflammatory, neoplastic, degenerative, environmental, idiopathic, whatever? You had to sort out which disease we are talking about. This is a chart which shows the main two groups, congenital and acquired. In congenital, it's the genetic, means you have some familial one, which is inherited. That is cystic fibrosis or spontaneous, means Down syndrome. Family doesn't have that, but it suddenly you see the baby with Down syndrome, so it's not inherited. Non-genetic means environmental, means the mother had rubella virus, and because of that rubella virus, the baby is born with that condition. Or accidental, during delivery something happens to the baby, that is called accidental one. Then acquired, inflammatory, again, acute or chronic. If it is acute appendicitis. Chronic, it's tuberculosis. Then we have growth disorders like a neoplastic one, means lung cancer. Non-neoplastic, it's a benign prostatic hyperplasia. Then we have injury or disorders like injury like bone fracture, or disorder like aspirin-induced gastritis. Then we have hemodynamic one. You may have shock when there is excessive loss of blood, or occlusive lesion like ischemic heart disease. Then we have disorder of immunity like immune deficiency, AIDS, or we have allergic condition like grave thyroiditis, which is autoimmune. Then we have metabolic one. Either you have diabetes mellitus, or you have degenerative disorder like osteoarthritis. So please kindly look that chart thoroughly. You might be asked questions from it. So if I ask any of the disease or any of the pattern, you must tell me which disease is going to happen here. Then we have characteristic of disease. Every disease, you had to have a logical framework. Like you had to have definition, epidemiology, etiology, genetic factor, morphology, clinical features, complication, and prognosis. So if you remember this chart, you will go along the disease like this. So I'll show you one case, and then we'll go according to this one. It will be easier for you then. In pathology, basically, we look four things. Number one is etiology. In Robbins pathology, if you go through, we start with four more important things. One is etiology. Etiology means cause of the disease. Which element is causing that disease? Etiology. Then number two, pathogenesis. What is the mechanism when etiology enters into the body? What changes it does which causes that problem? Etiology, pathogenesis. Number three is morphology. After causing that mechanism, they had made some changes in a body. That is morphology. You see it either it's gross or microscopic, both. And finally, clinical features. After having those changes, the patient has some clinical problem, right? And then you see it. For example, if he had malaria, then clinically he will be having high temperature, perspiration, palpitation. Yeah, these are the things which you see it, and then you finally do the laboratory investigation and diagnose the case, right? Yes. Previous slide. Yes. New plastic means tumor. Not, don't call it cancer. It's new plastic, means new abnormal growth, as we were discussing there.